invite Dr. Samir Belhaouari to the stage. Dr. Samir is the head of the Department of Mathematical and Computer Sciences at AlFaisal University. His research expertise are a combination of applied mathematics, pattern recognition, and data mining. He has achieved many honors and more than 100 publications. We look forward to hear a very interesting talk from Dr. Samir.
Assalamu alaikum, and very good morning. So my presentation will be slightly different angles to approach the problem. So, Assalamu alaikum and very good morning. So, I'll just present about computer and diagnosis. Is also data mining, but in different angle, like what Dr. Zaki present. So, my project was done by different universities and different countries too. So, for example, for the breast cancer and the neck cancer was done by hospital in Geneva, in Switzerland, and Petronas University in Malaysia. And for the face detection, for example, we can use it also for different companies between Singapore and Malaysia again. And for the gas identification was done by the University of Technology of Hong Kong. I would like to thank them all. So my presentation here does a small outline to do our introduction. Some issues very important about the images, our objectives, and some results. So just we start, here we're talking about a region of interest. So it could be cancers, could be faces, could be anything we are looking for. So for example, here we're starting by the cancer. Why? Because it's one of the main causes of mortality in the world. So in order to do the early detections to prevent lives, so is a must. So this disease is uncontrolled growth of abnormal cells. So the lifestyle, there is a link between the cancers and the lifestyles. So if we do the early detections, we can prevent people to be in the worst case. It can affect any part of our body. So according to 2008, 7.6 million passed away, which is extremely high. 70% of them comes from the low or the middle income countries. The common type of the cancer here is the lung and breast cancer for the male and female type. So we concentrate a lot on that. The low quality, so if you do the prevent, for example, if you talk about Alzheimer, if we can quantify the risk you will get sick after 5 or 10 years, we can prevent people to be sick. We ask them to change the way to live, do more sport, eat more healthy, and so on. So early diagnosis can save lives, so it's extremely important. So we need to have the doctors or radiologists to do the detection. It can never be done by human. So the breast cancer has just give statistics, so we can see that incidence and the mortality rate is extremely high. Here for the woman, so we can see the breast cancer is extremely high. For both sexes, I think lung cancer is extremely high too, and you can see the mortality is more than 18%. It's extremely high. So usually this is the CAD computer aided diagnosis. So we do screening, we do the diagnosis, we do the treatment, and we can follow up. So the role of imaging here could be signal, could be image. You are talking about breast and lung cancer, so mainly we talk about image. But if you talk about different region of interest, could be any input. Sorry, so here we have image, for example, ultrasound, mammogram, the CT scan, any different image processing. We do segmentation, feature extraction, and feature selections, and diagnosis. So this is some big issues. All the computer or the CAD exists now. There is a lack of trust between radiologists and hospitals. So usually, many people, the computer, the system exists now are extremely low in accuracy. There's a lot of false positive, false negative, so we need to fit. There is also here some micro cells of cancer, which will be extremely difficult for a doctor to do the detections. So we need to do more treatment on it. So here, mainly we use some advanced mathematics to do between time and frequency decomposition. So the false positive and false negative are extremely important. So we need to reduce them as much as we can. We do as study cases breast and lung cancer because are the main causes of mortality here. So there is research questions here: how to increase the trust between radiologists and physicians. So we need to build accurate system. How to reduce number of false positive and false negative, and how to be able to detect them. So our objective here, develop a perfect computer and diagnosis. How to investigate. So the idea here, we need to use multi-resolution techniques in how time, information in time and in frequency at the same time. Later on, usually those techniques gives a lot of features, so we are a lot of information, maybe we get confused, so we need to do reducing of features. Later on, how to detect the suspected region, but there's a lot to reduce it. Apply suitable classification to do the job. And at the end, we need to do all the entire simulation and with different databases existing and different databases from the hospital. So this is mainly all the idea we are using: analysis, implementation. So we do multi-resolution, feature extraction, feature selections, classification, clustering, and so on. So we have the image. We want to do the detection of the suspected region, do the classification by using the switchable features. So for example here, if we're talking about the cancers here, so the idea is we're using wavelet and curvelet transformation. But mainly curvelet and wavelet transformation are used for decomposition and extraction of the signal. But in our case, we don't need to do the extraction, so we just need to build a new function to be used by the wavelet. So how to do? We find we crop manually all the region of interest by the help of the doctor, finding the average or the mean of all these template images, going through up vertical and horizontal through our images, do the simulation of the metric that measure the similarity between our template and our own input image, do the calculation. Introducing here, for example, we introduce two new metrics. We call it K-square vector, and we can just measure the distance between our image and our template that we created, and we use the same idea as the wavelet with different scales, with different templates. And usually here, we try to measure these metrics as stochastic process. We do the second one is the sum of the square student distribution. So all are new metrics, and those, when the dimension is bigger, we can approximate it to the Gaussian distribution. And here we have the dose. And from here, all we go through to our image and we do the measurement. For each position, we have one value. And we start all here. So the image here, any minimum local is the suspected region to be a cancer or region of interest. So we can detect 4 or 5 or 6 or maybe more suspected region. And later on, we need to do the classifier. Is it the right one or not? So the input will be cropped later on. For example, if you apply it for the face detections with different background, input or outdoor and indoor, and here we can see, here there is the template. Here there is the template of all the faces. We take the average, for example, of all the faces, and we do the wavelet transformation based on that. And here we have all the minimum locus coming from the graphs here, and all the suspected region. Could be correct, could be not. So we need to do further details. Here the same thing. So we have our image here, and we call all the region here. This is our suspected region to be phase, region of interest. We do the wavelet feature extraction. We do feature selections. I will explain later on how to do it. And here we can say for each one, is it the right one or not? By using simple classifier with two classes, yes or no. Is it a phase or not? Or region of interest or not? Could be phase, could be cancer, could be a signal that we are looking for, could be a subsequence in the DNA or something else. And the same thing again. Classification process here. What we do here, we do a chaining system. We have databases. We split it to 40-30 or split it to 50-50. So we do the cross validation about that. So here we do the feature selection, feature extraction by using wavelet with different functions, or we can use our template. We do feature selection and we do the classification. And the same thing for the testing one, we're just getting the optimal parameter to our system. So the pre-processing, usually here we can do the histogram equalization to remove noises in our images. To make it standard, we can do 15 different types. So just here, for example, this is the origin image. After histogram equalization, it will be much better. We remove some noises and to be very clear for us. So the wavelet is very famous decomposition, but we are using our own functions to do the high and lower frequency. Feature selection, usually when we do the wavelet, we get more than 300 features, which is extremely high. So what we need to do, we need to compress those features by using two steps. The first thing we can use statistical energy, because all the energy is focused in 10% of all the features. So we need to remove all the small features. Here we can use to measure that this feature, is it the right one to do the discrimination between two classes? So we need to do the hypothesis testing. This is in one dimension. We can use other difference between the overlapping between two Gaussians by using this type of calculation, or we can use the MMG, the multiple Gaussian metric, to do the overlapping in the right way. And here we can use the minimum or the maximum in order to say there is some differentiation we can accept it or not. So our classifier is by using the usually k-means cluster, but we do k-means cluster are lacking by 2 points, number of classes and how to start our vectors. So here we try to do some modification on it. So for each class, we need to find subclasses by using the k-means modifier, and we compress our data by, for each subclass will be represented only by the center. And here, from the beginning here, a lot of data we can just compress by a few represented for all the subclasses. And we can here use the nearest neighbor classifier, which is extremely famous on it. And here we are minimizing time of calculation and increasing the accuracy of our system. So at the end, now we need to test our approach. Is it accurate? Is it less false positive and false negative? So we use, for example, the breast cancer using mammogram. And the detection area here, the detection rate, it was 97% with 3% false positive and 9% false negative. And this is, for example, here, this is our image input, and here all the results we can get two different types of cancer here. Or we can use lung cancer by using CT scan image. And here the detection, it was extremely perfect, 100%, with 0 positive, 0 false positive, and 0 false negative. And this here, this is the radiologist tell us the area of location of the cancer is here, and this is our output, which is extremely accurate with the radiologist. We use it again breast cancer here. So here we find this is our input. Those are all suspected area to be a cancer, and here by using the minimum locals of our matrix, and after simple classification of all those suspected areas to detect the right one. And then the same thing, we can use different scales, because there is small cancer region and there is big cancer region, so we do the same thing with different scales of our template that we created by using our database. And we test the system again here about the classification. Is it normal or abnormal? And if it's abnormal, there's many types of cancer. So here it was perfect result again. Later on, if it is abnormal, which type of cancer? We have here benign and malign cancer. One is not dangerous, and the second one is extremely deadly. And the classification, it was perfect, and this is also because the mammogram is extremely clear image. If this is type of cancer, we need to detect which type of cancer it is, and here the result was low, 74%. So we need to introduce new techniques to do the classification in order to enhance those results. So this radiologist will not take our system at all, will not buy it. So we need to be more than 95 or 96 accuracy. So in order to fix this one, we introduce the 3 classifications. It's just by the principle of elimination. So we classify the cancer one against the odds. Later on, we classify the cancer type 2 with the odds, and so on. And here we jump from 74 accuracy to almost 99.7%. For example, the first one, it was the classification here, is 1. Later on, between second and the others is 0.97, and so in the average we have 99.7. We use the lung cancer with X-ray because all the medium or lower income countries, they don't have the big systems to do the mammogram images, so it's better to work with X-ray devices. And here the classification, it was extremely good, 99.7 NT with X-ray with very low quality of images. We started to get extremely high result. Benign, it was 98. Later on, we do with normal and abnormal classification again with lung cancer, and this is quickly all the results. Lung cancer with normal and abnormal, and this is type of debate about the databases. And here, later on, we have 200,000 features from the wavelet. We need to compress it to as small as we can, but we need to keep the high accuracy. So here we did the graph. Here is the blue one is our maximum accuracy, and this is number of coefficient that we need. So we can see here at 100 features, it will be more than enough to do the right classification. And here later on we can do the inverse wavelet transformation in order to give to the doctor this is the shape of our cancer for further details or further study. The system being tested, and we can, in order to use the wavelet, we can use the curvelet, we can use the ridgelet. There's a lot of mathematical transformation we can use it, or we can combine both of them in order to get the right or suitable features to do the classification or to do the segregation between different cancers or different classes. Here we do with normal, abnormal, and still 96 is not so high. Benign, it was 87, which is not really accurate. The radiologists or the doctors will never buy such type of system. But if you combine between the both, we can see difference in result. So here we combine between wavelet and curvelet, we get just the best features from the two transformations and combine them to get or to enhance the result. And here classification is 99, benign is 92, which is not so high. So example here, so now what we did, I want to compare it all the existing system with different algorithms. So for example here, in 2011, so the accuracy or sensitivity was 90%. In 2012, 90%, 94%, and our method is there is significant improvement in the result. Here also with the length CT scan, we can see here for 97, 82, 87. So our result it was extremely perfect. And later on here, all what we did, we are measuring each feature alone. For example, if we are doing, for example, DNA, as the presenter said, so we need to identify the subsequences. In order to do subsequences, we need to measure set of features. For that, for example, here, if for example we have two features, X and Y, and if we measure only X feature, we can see if we do the projection here on X axis, we can see there is a big overlapping. So we cancel the features. Y, the same thing. If we do the projection in Y axis, we can see there is a huge overlapping. So if we use only one feature, we cancel the X features and we cancel the Y features. But if we see the problem in the high level, we can see X and Y, combine both of them, we can get the right aggregation between the two classes. So we need to measure the features with higher dimension. But to use that, we need a lot of tools, mathematics, in order to do the hypothesis testing between different features. And this is our last working here, our last paper. So just give you a brief details about the hypothesis testing with high levels. And this could be done for the DNA or for the protein in order to detect the subsequences that make the difference between different classes or different subfamily according to the functionality. And this is here we need to normalize our metric by using the Gaussian vector. And here all the things we need to do the estimation about the matrix covariance. We can get negative eigenvalue. We need to do the correction again. And this some how to reduce time of calculation, because usually when you have a huge number of features and you need to select two features, you have combining two from n, which is extremely high. You can do 3, 4. So we need to reduce time of calculation by using some simple integrals. So I'm going to go quickly in the details. So this is a rough idea. So here we are using the system for breast and lung cancer. We can use it for face detection, or we can use it even for gas identification. So thank you so much for your time. Any question, would be welcome.
Very question.
Thank you for your presentation. I have two small questions. The first one is related to the comparisons. I know always when you compare the customers you have, they are very sensitive. So you have to use the exact data set and the exact setup.
Exactly.
And the second one, when you mentioned about the feature selection.
Yes.
And you said all information exists in some attributes. This is not, exactly the case, because each feature has information, but with a different person. In addition, it is not consistent. So you have 1,000 features. You can't say that only 10 has all. You can say most.
Yes, okay. So to answer the first question, in order to do the comparison, we need to use the same database, of course. So all the comparison here is done by using the same databases under the same condition, but with different approach in order to do the comparison. When I said some features are suitable for classification, because we have two classes, for example. So some feature that can make the difference and some features are exactly similar. This is one. And the second one, some features in terms of the pixel value are extremely low. So this is in terms of energy, we can cancel them. But maybe they can give some extra information, but it's not enough to do the classification. Is it right?
Yes.
Yeah, person.
Yeah. So I'm a commercial quantity. I just don't see the advantage of applying clustering and the safety means classification. Why do we go for clustering? Why we don't just apply canary neighbors directly? In fact, I see that we are removing some useful information that we do clustering.
Yeah. Yeah, because usually when we do the clustering, I need to decrease the values inside each cluster, and we need to increase the values between different clusters. So if we have one cluster here, and the variance in this cluster is extremely small, so it will be enough to be, this cluster will be represented by only one value. In time, later on we do the classification by nearest neighbor in order to decrease time of calculation. I think with all those clusters, it will be enough to do one. And we do the comparison here by using all the information and by using just compressing the data, we get high accuracy and lower time of calculation. But we need to do for each class, we do subclasses, different sources maybe can, and each one will be compressed by only one, only dependent by two values. Like most people.
We have a question on the ladies' side. Yes, please.
Final, you mentioned something. You said when you have the negative, when you have.
You said when you have a negative eigenvalue, you do kind of transformation.
Yeah, exactly. For example, when we do the estimation of the matrix of covariance, it should be defined positively, and sometimes we can get the eigenvalue are negative or equals to 0. So it means our estimation is not accurate. So how to solve it? In order to get, we can replace the eigenvalue to very small positive value, which is done, or we can just make a rotation of our eigenvector little bit in order to do small correction.
Does it affect later on?
No, because it's extremely slight difference. Because the estimation should be right, so it means the matrix should be defined positive. Defined positive means all the eigenvalue should be positive. Yeah.
Thank you very much, Dr. Samir. I would like to invite Dr. Silvana to present the appreciation.